A doctor gets sued, not for malpractice, but for trusting a computer. The algorithm told them to deny treatment, and the patient died. The doctor's defense? I didn't know how it worked. The judge's response? You should have. Here's the thing nobody told you. While you were worried about ChatGPT stealing jobs, the government just rewrote the rules on medical AI, and your life might actually depend on it. Have you ever wondered who's really making decisions about your healthcare? Your doctor or a computer program they don't even understand? Let's talk about something that happened in early 2024 that almost nobody noticed. The Department of Health and Human Services dropped a regulation called HTI-1. Sounds boring, right? Like someone sneezed on a keyboard and made a policy name. But here's what it actually did. It forced every tech company selling medical AI to open up their secret recipe book. For the first time ever, they can't just say, trust us, it works anymore. They have to prove it. And the tech companies, they're losing their minds. For decades, these companies operated on one simple principle. Proprietary means untouchable. You want to know how our algorithm decides if you get that kidney transplant? Sorry, trade secret. Curious about why the AI flagged you as high risk for heart disease? Can't tell you. Competitive advantage. It was the perfect scam. Sell hospitals a black box, charge them millions, and if something goes wrong, just shrug and say the math is complicated. HTI-1 killed that game. Dead, gone. The rule says if your AI is built into an electronic health record system, you need to slap a nutrition label on it. Not the kind that tells you how many calories are in your algorithm, but one that tells doctors what data you used, how you checked for bias, and whether you actually tested this thing in a real hospital or just ran it on a bunch of spreadsheets in Silicon Valley. The scope of this is kind of insane. We're talking about 96% of hospitals in America. That's almost every single one, and 78% of doctors' offices. If you've been to a hospital in the last year, there's a really good chance this rule now applies to the AI that might have touched your care. This isn't some pilot program in 3 hospitals in California. This is everywhere. So what does this nutrition label actually say? The government created 5 standards. They call it faves because apparently someone in the Department of Health and Human Services thinks they're clever. It stands for fairness, appropriateness, validity, effectiveness, and safety. Let's break down what each of these actually means because the names are doing a lot of heavy lifting. Fairness means the AI can't be racist or sexist. Sounds obvious, right? Except medical AI has been quietly discriminating for years. There's this device called a pulse oximeter. You've probably had one clipped to your finger at a doctor's office. It measures oxygen in your blood. Turns out it's less accurate on people with darker skin. Why? Because it was trained mostly on white patients. The algorithm literally couldn't see them properly. So fairness isn't just a nice idea. It's fixing actual harm that's already happening. Appropriateness asks if you're using the AI for the right patient. This sounds simple until you realize what it's preventing. An algorithm designed to predict heart attacks in 60-year-old men shouldn't be used on 25-year-old women. But guess what was happening? Hospitals would buy one algorithm and use it on everyone because it was cheaper than buying multiple tools. Appropriateness says you can't do that anymore. You have to actually match the tool to the patient. Validity is just asking if the math is correct, which again sounds obvious. But you'd be surprised how many algorithms got approved with completely garbage math. There were tools making predictions with accuracy rates barely better than flipping a coin, and hospitals were paying 6 figures for them. Validity means someone actually has to check the homework now. Effectiveness wants to know if the AI actually improves health, not just if it makes a prediction, but if that prediction leads to better outcomes. Because here's a dirty secret. A lot of medical AI is great at predicting things and terrible at actually helping. An algorithm might be amazing at identifying who's at risk for diabetes, but if nobody does anything with that information, who cares? Effectiveness says the AI has to actually make people healthier, not just make charts look impressive. Safety is the one everyone pretends they were always doing. It asks if there are unintended risks, like does your AI accidentally flag every elderly patient as too high risk for surgery, meaning they never get treatment? Does it create false positives that lead to unnecessary procedures? Safety means thinking about what could go wrong, not just what could go right. Now here's where this gets interesting. The rule also requires something called cautioned out of scope use. Basically, the AI has to tell doctors when not to use it. Imagine buying a car and the manual has a whole section that says, do not drive this vehicle in rain, snow, or on Tuesdays. That's what these companies have to do now. They have to admit the limitations of their own product. You can imagine how thrilled they are about that. And if they refuse, if a company decides to hide their AI's performance data or pretend they don't have to follow these rules, they get hit with something called information blocking penalty. abnormalities. The fine can go up to $1 million per violation. Suddenly, being transparent sounds a lot cheaper than being secretive. The thing is, this didn't come out of nowhere. There was a catalyst, a scandal so big it basically forced the government's hand. United Health, one of the biggest insurance companies in America, was using an AI called Enhance, and Enhance had one job: deny care. It would look at patient cases and predict how long they needed in rehab or nursing homes. Except it was wrong constantly, and when it was wrong, people got kicked out of care early. Some of them died. Families sued. Lawyers dug into how Enhance worked, and you know what United Health said? It's proprietary. We can't show you. They hid behind trade secrets while people were losing their parents, their spouses, their kids. The lawsuits happened in 2023 and 2024, right as HTI-1 was being finalized. Coincidence? Absolutely not. The government saw what was happening and said enough. This wasn't just HHS making up rules in a vacuum either. In October 2023, President Biden signed an executive order on AI. It was basically marching orders for every government agency to figure out how to regulate this stuff before it got out of control. The HHS took that order and built HTI-1. It was the first real answer to the question, how do we make sure AI in healthcare doesn't kill people? And now, in late 2025, they're doubling down. The HHS released a new AI strategy that takes HTI-1 and expands it. They're calling it the 1HHS approach, which sounds like a corporate retreat team building exercise. But what it actually means is that every part of the health system has to coordinate. The FDA, which approves medical devices, the CDC, which handles public health, and CMS, which decides what Medicare and Medicaid will pay for. All of them are now using the same standards for AI. The goal isn't to treat AI like a cool gadget anymore. It's to treat it like core infrastructure, like electricity or running water. Something so fundamental to how hospitals operate that it has to be regulated properly, or everything falls apart. And part of that infrastructure plan includes workforce training. Hospitals now have to teach their staff how to critique an algorithm, not just follow it blindly, but actually question it, ask if it makes sense, push back when it doesn't. Which brings us to the liability problem. Doctors are now in this weird position where they're legally required to have access to information about the AI they use. That nutrition label isn't optional, it's mandatory. And if a doctor doesn't look at it and something goes wrong, the liability shifts. They can't say, I didn't know anymore. The information was there, they just ignored it. So now you've got doctors who went to medical school to learn how to treat patients, and they're being told they also need to become amateur data scientists. They need to understand training data sets and validation processes and bias checking. It's like asking a pilot to also be an aircraft engineer. Sure, it's useful, but it's also exhausting. And the tech companies, they're furious. For years, their entire business model was built on secrecy. The algorithm was the secret sauce, the thing nobody else could replicate. Now they have to publish how it works, what data they use, and where it fails. It's like Coca-Cola being forced to put the recipe on every can. Some companies are complying because they have to. Others are fighting it in court, claiming it violates intellectual property laws. But here's the thing they're missing. Transparency might actually help them. Because right now, hospitals don't trust AI. They buy it because they feel like they have to keep up with technology, but they don't actually believe it works. Doctors are skeptical. Patients are terrified. If companies can show their work and prove their AI actually helps people, that trust starts to build. The problem is, most of them can't prove it, and that's why they're scared. Let's talk about what this means for regular people, for you. If you go to a hospital tomorrow and a doctor uses AI to make a decision about your care, that AI now has to meet these standards. It has to be fair, appropriate, valid, effective, and safe. It can't be a black box anymore. Your doctor has access to information about how it works, and if they don't use that information, they're on the hook. Does that mean your next diagnosis will be more accurate? Maybe. The AI is probably better than it was before because it had to pass actual standards instead of just existing. But it also means your doctor might spend less time talking to you and more time arguing with the computer because now they're responsible for knowing when the AI is wrong. They have to second guess it, which is good for safety but terrible for efficiency. There's also this weird future we're heading toward where the AI is transparent but still incredibly powerful. You might go to the doctor and they'll say, the algorithm says you need surgery. You'll ask why, and they'll show you the nutrition label. They'll explain the training data, the validation process, the bias checks, and you still might not understand it because transparency doesn't mean comprehensible. It just means the information exists. So we're creating this system where everyone knows how the AI works in theory, but nobody really understands it in practice. Doctors are overwhelmed, patients are confused, tech companies are angry, and the government is just trying to keep people from dying because a computer made a bad call. Here's the uncomfortable truth. This policy is probably necessary, but it's also exposing how unprepared we are for AI in medicine. We built these tools faster than we built the rules to govern them, and now we're scrambling to catch up. HTI-1 is a step in the right direction, but it's also a reminder that we let things get way too far before anyone pumped the brakes. The companies that claimed their algorithms were saving lives couldn't prove it. The hospitals that bought those algorithms didn't know how they worked. The doctors using them were just hoping for the best. And the patients, they had no idea any of this was happening. HTI-1 forces everyone to confront that reality. It's not a perfect solution, but it's the first real attempt to make medical AI accountable. And the wildest part? Most people still don't know this rule exists. It's changing healthcare right now, and it's doing it quietly. No big announcement, no press conference, just a regulation that went into effect and started reshaping how hospitals operate. By the time most people realize what happened, it'll already be the new normal. So what happens next? Companies will adapt or die. Some will figure out how to be transparent and still competitive. Others will fade away because their AI was never that good to begin with. Hospitals will train their staff and try to keep up. Doctors will learn to navigate this new world where they're part clinician, part data analyst, and patients will hopefully get better care because the tools being used on them actually work. But let's not pretend this fixes everything. Bias still exists. Algorithms still fail. Transparency helps, but it doesn't solve the fundamental problem that AI is only as good as the data it's trained on. And if that data is flawed, the AI will be flawed too. HTI-1 makes it easier to see those flaws. It doesn't make them disappear. The government is betting that sunlight is the best disinfectant, that if we force these companies to show their work, the bad actors will get exposed and the good ones will thrive. It's a nice theory. We're about to find out if it's true. Your healthcare is being decided by algorithms right now. The only question is whether anyone knows how those algorithms work. HTI-1 just made that mandatory, not optional, not recommended, required. If this matters to you, hit the like button. If you want to know when the next quiet policy drops, subscribe, because they're not going to announce it on the news. They never do.